Hey everyone, OT Lifehack here. I hope your weekend is going well. It's so cool because so today, oh my gosh, I had such a blast. I mean, I know I say that in every video, but it's so true. So it was since probably, let's see, day 6, day 7, day 5, I don't know, it's I'm losing track already, but I got to do, since then I have essentially been treating a patient on my own, continuum of, well, not continuum of care, but for the stay of this person in the hospital, I've been the one that has been doing the treatments with this person. And I mean, I see other people as well do treatments and, well, more so evaluations. That's more so what we do for occupational therapists. The certified occupational therapy assistants would do more of the treatments. And so when we finish the occupational therapists, when we finish the occupational therapy evaluations, all of them on our list, then we can do treatments. It's like a cool bonus. And so we've been fortunately finishing our list earlier because I'm getting better at seeing patients on my own. Woo! And so we're moving faster. That's how you know that I'm learning my stuff, because I'm getting faster at things. Documentation, chart reviewing, and seeing the patients. Oh, phew! Tap my shoulder. Yay! And I'm sure you guys are doing awesome too. For all of you who are in your level 2 fieldwork, and for all of you who have already done your level 2 fieldwork and recall those experiences when you were feeling like an actual occupational therapist, it's such an awesome feeling. Oh, I probably drive my supervisor crazy because I'm always like a hyper ball of energy, super stoked and excited, while trying to maintain the professionalism that's like chill, calm, and not looking like a little happy kid all the time. So back to the patient that I have been overseeing treatments for. We've been doing mostly, it's been more so of hand range of motion, well, the left side upper body strength, range of motion. And so, and we haven't done any strengthening yet. We haven't done any strengthening yet because the occupational therapist mentioned that if it's not in the orders to do strengthening put out by the doctor, then you do not do strengthening. You focus on range of motion, and when that is all better, then you do strengthening, which is why I'm so excited, because my supervisor, oh, interesting, speaking of my supervisor, he knows I'm talking about him. He just sent me a good job for today. Woo! Oh, the blessings. So also, a little note, side note for supervisors out there, fieldwork educators, it is really helpful to get positive and constructive feedback, because many times we want to know what we're doing well and what we can improve on. So having a little acknowledgement of the good stuff is always welcoming. So thank you to all the fieldwork educators and supervisors out there in occupational therapy. Back to the person that I have been working with one-on-one. So as I said, we've been doing the range of motion exercises, and so they had an injury on their forearm, and so doing exercises like moving their arm up and making a fist and raising the wrist have been difficult things for them, stuff like this. So we've been doing a lot of exercises for the hand, and even for the shoulder, and for the elbow, and the fist, bending, extending, bending back. So we've been doing a lot of those exercises, and the goal is to have them be able to do full range of motion without having their other hand support them in doing all of that. And so they've been very good at doing their homework, and it's so cool because the OT that I've been working with, the supervisor, who has essentially been letting me go visit the patient all on my own for the past several treatments I've done with the patient. We did the eval and we did the treatments, and it's all been us seeing this patient, and it's so cool because the OT brought to my attention the note that the doctor wrote, and the note said that the patient has been doing full range of motion, has full movement, in their hand and upper body now. So they're on their way for strengthening, which is the next step. So once they get all of their full range of motion, full movement of their hand back without assistance from the other hand, then they will get strengthening. And so they're on the verge of strengthening soon. And it's been, it's so cool. The funny thing is that the OT brought it to my attention, not so much because he's like, look, you did well. Yes, you did well, but he brought it to my attention because he's like, look, it says PT on it. Because it says, the patient has been working with PT, which no, there's no PT. It's just occupational therapy that the patient has been receiving. And they're like, the doctor's note said, the patient has been doing well with PT and has full movement of the hand and arm. And I was like, that's so cool. Sure, it says PT. And it kind of, that does get a little blurry because you are doing more so like range of motion type of things that people often associate with PT. And that's not necessarily true. It's the purpose of what you use the range of motion for, which for OT we use it for being able to do your schoolwork, do your eating and such, doing your activities of daily living, all the things that you have to do in your day. So there's always that challenge between what does OT and what does PT do. But again, the awesome thing is that OT, occupational therapy, does make a difference. Look at the things that we can do to see a person be able to get from having absolutely no use, having very, very, very limited use of doing just this maybe, but with extreme pain, and to now being able to, essentially they can start playing the piano now. Woo! Oh gosh, it's so cool. So that's one of the reasons that I am absolutely in love with occupational therapy, one of the many reasons I am in love with it. And for those of you doing your fieldwork level 2A and being an occupational therapist yourself, please do share in the comments below what it is that you love about occupational therapy, because there is so much to love. So if you enjoy watching my daily videos on occupational therapy and just find my videos helpful, please do let me know by liking the video and subscribing to my channel. Thank you. And also sharing this video with other occupational therapy gurus, those who are interested in occupational therapy people, and also maybe to some doctors, nurses, other professions, to kind of give more share on what occupational therapy does, because by understanding more of what all the other professions do, we can better coordinate services, know what is needed for the patient's care, so that's always helpful. Alright, so talk to you all later. Again, like this video, thank you. Subscribe to the, that's like a boo. Subscribe to the channel and share this video with others. Alright, talk to you later. Bye bye.